I'm Yonette Thomas. As a social epidemiologist, I focus on the dynamics of urbanization and health at the community level. Currently, I'm Dean Scholar at the School of Public Health at the University of Memphis. When I'm not an academic, I lead Urban Health 360, which is a global institute focused on bridging the divide between the science of urbanization and health and the dynamics of urbanization and health in communities. I present to you a lecture on human security, housing, health, and well-being. Urban Health 360, our focus, as I said earlier, is on the divide between the science of urbanization and health and the application of the dynamics of urbanization and health in communities. From our perspective, what is needed is a stronger link to the academic perspectives on the social determinants of health and well-being as it relates to urbanization at the community level. Urban Health 360's applied urbanization and health approach incorporates the translation, amplification, and actions to address the health of urbanizing population. It includes the expression of how the health of people in urban communities impacts daily life and life course. At this juncture, we focus largely on the global south. The conceptualization here is that rapid urbanization worldwide is raising new social, economic, public health, environmental, and health systems challenges. So when we think of the urban physical environment, it's a constellation of factors that include food and food sources, road networks and transportation, housing, physical and public spaces, water quality and sanitation, noise and traffic, indoor and outdoor pollution, waste management, health and social dynamics, and environmental factors like flooding, increased heat indexes, etc. Why do we focus on quality of life when we think of the intersection of human security, health, and well-being? It's a necessary focus that brings us to the underlying slogan of Urban Health 360, which is urban health is a microcosm of global health, and that all the factors impacting the health of urban populations around the world must be addressed. As we all know, as you've read and if you've studied and perhaps written about, by 2050, 2/3 of the world's population will reside in urban communities. In other words, 90% of urban population growth will take place in low and middle income countries. Most of those countries exist in Africa and Asia. We've had an intervening factor in recent time, which is the COVID-19 pandemic, that's really pushed the urgency, the need to address issues of health equity in urbanizing populations because it's linked to economic viability. In 2020, we began the last decade of the 2030 SDG goals, achieving those goals by 2030. And we're now in a scenario where we're thinking of 2030 and beyond, all as a result of the influence of the COVID-19 pandemic. So let's think together about why there's a link between human security and quality of life. And when we think of human security, we realize that human security is linked to freedom. And there are 4 integral factors that underpin freedom. Freedom from fear, freedom from want, freedom from shame, and freedom from vulnerability. When we think of sustainable human security, health, and well-being, these 4 items on the screen help you to understand how they intersect. And I will briefly just say, as you can see, it's linked to localized as well as national and global health, economics, and well-being. And as I said before, the COVID-19 pandemic has refocused our thinking on how those things interact and intersect to create safety and freedom from fear of vulnerability. And when we think of the elements of sustainable human security, they're the common elements that we think of. Common elements like the political environment, the economic environment, health and well-being, that includes mental health, planetary dynamics, housing, food, personal and social, all of those interacting together on a continuum of equality and resilience that frame together well-being, health and well-being, economic viability. So this focus of this lecture is on housing as it relates into this constellation of needs that create viable communities and families and countries. So why focus on quality and adequate housing? Well, simply, housing quality is essential for population, health, and well-being at the local level, at the national level, and at the global level. So to reiterate, we think of housing at the local, national, and global level. What does that mean? Well, it means access to adequate, affordable, safe housing. And if there's access to those things, that attracts economic investment, a diverse workforce. People can work knowing that they have a place to rest, their family can live safely, and it increases levels of social and economic development and a sense of community. So thinking about those things, the World Health Organization presented the housing and health guidelines. And in those guidelines, they highlight interventions that protect both individuals and family from cold and heat and damp and mold, from vector-borne diseases, from injuries and other hazards. So those guidelines create a set of norms and standards, provide new evidence-based recommendations, bringing together previous and existing WHO guidelines into one compact, wholesome group that focuses on a sector as opposed to specific health risks related to housing or specific interventions or specific activities or policies, but it's a comprehensive perspective on the topic of housing and health. And fundamentally, the articulation there is that having a comprehensive focus on housing and health enables the health sector to inform housing and energy, community development, urban development policies at the national, local, regional, and global levels. So there's a lot of research that supports those guidelines and continue to support them. The research that focuses on better housing and the potential to improve health and well-being. I will call out a few, like Philippa Howden-Chapman and her colleagues, and the work they've done in and around Wellington, New Zealand, that has applications for the world and beyond in other countries. The work done by Andrew Perry at the Brookings Institution in the United States is another important leader in the thinking of housing in cities and communities and the link to markets and the financial sector and economic viability of communities. So I encourage you to take a look at many of these references that broadly help us to understand the integration, how integral housing, good and quality housing for all, is to health and well-being and economic viability. I call to your attention to the annual review of public health, in which Howden-Chapman and her colleagues did a major review of all of the dynamics related to healthy housing and well-being and how it influenced economic viability, and where Howden-Chapman and her colleagues focus on housing pathways to health, you see this dynamic model that I'm referring to. And I encourage you to go through it and see the broad dependent variables and all the intervening factors that together lead to an understanding of the intersection and the dynamics related to housing, health, well-being, including mental health and wellness, and how families, communities, and countries would be more viable economically and socially if these multiple factors are addressed. Cross-sectoral action will engage communities, will enable the listening to what communities need and what they understand to be the issues impacting their health and well-being. It would give voice to their perspective and suggested solutions. It would also engage municipal and national leaders and implementers and the private sector to enable the reduction of social and economic inequities related to housing and health. This requires an ongoing focus if we are to have sustainable solutions, if we are to have adaptive implementation to improve the health and well-being outcomes. Doing this will help us to prioritize localized operational changes to help evaluate different ways of providing public and affordable housing. It would also create sustainable partnerships. We talk a lot about public-private partnerships, but those partnerships have to involve community, municipalities, thought thinkers, the doers, the leaders at the municipal level who are implementing the changes, and the engagement with thought leaders, members of the academic community, but not just the academic community members who understand what is happening at their level and often have ideas for adaptive solutions for the adaptive implementation of viable solutions. In some, communities and municipalities are integral to achieving urbanization and health and development goals by 2030. These are the Sustainable Development Goals, which all of them impact this movement of peoples from rural communities into economically viable communities that become more urbanized. And not just for 2030, it would be 2030 and beyond. So leadership in urbanization and health planning and implementation really need to improve the focus on urbanization and health and address the broad determinants of health if we are to achieve the sustainable goals by 2030 and beyond. We must all focus on promoting collaboration that will advance solutions and implementation opportunities that include healthy housing, reduction of substandard housing, and reduction of homelessness. And leadership at all sectors must include community leadership, as well as individuals in communities. We must listen and engage them and understand at the community level what are the needs and what are potential solutions that can work at the local level, at a regional, at the national level, and in many instances across countries, because communities are very similar. And there's a massive movement of people from within country and across countries. So in order to achieve sustainable solutions, we really need to engage. There needs to be a dynamic engagement of multi-sectors and the community to address these needs and challenges that will continue to emerge, and to help us to respond to similar scenarios like COVID-19 as new diseases, new environmental challenges emerge. Thank you for listening.